Omicron was very serious, unfortunately, and that of all the waves, and that's kind of what we continue to experience is these waves. And the Omicron wave is probably the one that hit us hardest, both from a patient perspective, having an influx of inpatient census higher than what we had experienced in any of the previous surges or waves, but then the impact on staff. So currently we have, and again, this is contrasting kind of current state to where we've come from recently. So currently we have 4 employees that are off due to COVID positive tests. This time last month, we had over 25. And I think that the highest number I'd seen at any one time was 29, and that was in any day. But then you can imagine that has a cumulative impact. And so, it was very, very stressful for the organization on many fronts to manage through the Omicron. So I'd say now, it's one of those where we've had so many waves, and Dave gave me this great analogy last week. Dave, hopefully I'm not stealing any thunder of yours, but it's from his own experience. Being in kind of war zone type of situation. Normally, then you do your 2 or 6 months or whatever, and then you go and recharge. And I think it's almost like our recharging is when we're in a trough of one of these waves, but not necessarily still a sense of, okay, is there an end in sight? I certainly am hopeful. That's what the experts seem to be talking more about, is switching to an endemic. But again, that's where I'm going to defer to Dave on any of those kinds of discussions, because at this point in the pandemic, I'm beyond prognosis. So I'm just kind of making sure we keep good morale, that folks are making it through, that we're supporting people, and we're helping people get through this. And we have on the workforce side, just to give you a couple areas, we have record numbers of openings for us. And again, this is a relative thing. And so for us, we have 11 MAs, we have 10 RNs that are open. We've never had that many openings before. And then the duration of the openings, is also, whereas in the past, a typical RN, because we're generally considered a really desirable place, a good place to work. So usually when we had an RN opening in the past, again, pre-pandemic, we would close that within a month. We'd be able to fill it. And now it's very typical that extends 60 and 90 days in some cases. And so it's a very different challenge.